Hi, I'm Adam Tomastik, and today I'll be presenting to you via YouTube a speech that I recently gave in my public speaking class. This speech concerns the disparity between the treatment of mental health versus real medicine by insurance companies in the United States. Consider the story of Cooper Harding, on medication for mental illness before he was in kindergarten, and at age 6 he was admitted for his third hospital stay, after which he was promptly dropped by his insurance company because they were no longer required to cover him. He's now age 12, he has bipolar disorder, obsessive-compulsive disorder, and Tourette syndrome, and his family is struggling to pay for the treatment of all these conditions. This story was published in the Arizona Republic, a newspaper in Arizona, in 2006, and this story is sort of a microcosm of the problems for the treatment of mental health by insurance companies and its coverage. Mental health is not regulated the same in all 50 states. It's not regulated the same as other physical ailments, and which means there's no parity, which I will explain in a few minutes. This information can be obtained on NLCS.org, the National Conference of State Legislatures website. So why does this matter? Why would we care? Why would this matter to the average person? Well, 10.6 million people in the United States suffer from what are considered serious mental conditions, and that's not even considering smaller mental ailments. It's the greatest cause of disability in America, and this information can be obtained from NAMI.org, which is the National Alliance on Mental Illnesses website. Now, parity, which I'll now explain, means that insurance companies provide the same level of benefits for mental health care as physical problems. The problem with this is that there are many interpretations for what that means by the same level of coverage, and many states actually don't even come close to regulating mental health treatment as they do as physical disorders. The National Alliance on Mental Illness, who I just talked about, ranks states every few years on their mental health treatment and the coverage they provide in many different areas. And in February 2009, the National Alliance on Mental Illness just published a new report. One of the shocking things in this report is that no states got an A, which is a bit startling. 6 states got Bs, 18 got Cs, 21 got Ds, and 6 got Fs. The national average is currently a D, which is actually an improvement over what it's been recently, but still quite terrible. The state that I live in, Pennsylvania, got a C, which is an improvement from a D+, which they had in the last report in 2006. Some of the positive things about the coverage in Pennsylvania is that it's a national leader in reducing seclusion and restraints on mental illness. It's good at creating consumer and family satisfaction teams. And Pennsylvania does a good job of training and employing peer specialists in the mental health field. Some of the bad things, or things that need improvement, is that Pennsylvania needs expansion on mental health courts and jail diversion programs, and also needs more of an adequate mix of hospital and community services. Now, Arizona actually, in 2009, received a C, which is also an improvement from the same grade as Pennsylvania, a D+, back when the story of Cooper Harding was published in 2006. Now, you're probably wondering, what can be done by us? Can anything be done by average people? Well, the first thing that people can do are donating to causes like the National Alliance on Mental Illness. And actually, the popular TV show House is donating proceeds from t-shirt sales. Also, the average person can petition Congress, and that's actually what happened in Arizona in 2006. Petitions were started because of the poor coverage of mental health, and they've actually improved somewhat. They're not quite there, obviously still getting a C in the 2009 rankings, but they have improved somewhat since the story of Cooper Harding was first published. And also something that's more of a broad thing, not just petitioning Congress or donating to causes that would help change mental health, but it's sort of reducing the stigma of mental health and in words that are used commonly in the media. Now, obviously, this is something that would take more time, and this is sort of a more broad topic that I won't get into too deeply. So, In conclusion, what can we really help to change? Well, sort of on a positive note, some states are becoming more well off. States like Connecticut, that received a B in the newest rankings, and others actually are improving year to year. So hopefully we can continue to see this improvement. But the things that we want to change are earlier treatment for illnesses. It's been proven that there are better outcomes with earlier treatments. This is from a schizophrenia newsletter, and this doesn't just apply to schizophrenia, but many other mental conditions that if treatment is started early in children or adults, their outcome is much more positive if they start early on in their condition. So this is a fact that I left out at the very beginning of the speech, but I wanted to sort of hit home with this last fact, and that's that 1 in 4 Americans will be diagnosed with some form of mental illness in their lifetime. Now, this doesn't necessarily mean it's a very serious condition, but nonetheless, 25% of all people in this country will be diagnosed in their lifetime with a form of mental illness. This is pretty shocking. I don't know if everyone knows about this number or not, but this is sort of why we need to get these laws improved and petition Congress, because if you come down with a condition or someone in your family, even if it's not you, someone you care about, you don't want to have to hope that you live in a state where you'll get proper coverage. You want to know that that already exists. Thank you.